Hey, welcome to another edition of the Trustcast Show, and we're really happy to have on with us Dr. Michelle Jones Singer, a board-certified gynecologist and the only cosmetic gynecologist in Indianapolis. And she helps women feel confident and comfortable in their own bodies. And when she's not in the exam room, she has an unusual other occupation. She's behind the microphone as a professional voiceover artist. So you're a surgeon who also has a professional voiceover studio in your house. How did that happen?
Well, seemed as if it was just a natural transition. I speak with patients all the time. I communicate. It's important to be clear, have a good tone, have a good intention, and understand what I'm saying to them so they will receive me in a good way.
And so how did it go from how did you end up doing actual voiceover work? What was your first gig? I'm just curious about the transition there.
My first gig was a medical gig, medical education gig.
And how did they find you?
I just advertise for myself. The way we do it is we email market. That's part of the whole process. Also, I'm on a platform that sends me opportunities to audition on.
Okay, fantastic. So what made you want to become a gynecologist?
That's something I've always wanted to do. Female health care was an important thing from even when I was a little girl. Went to a pediatrician when I was about 8, and I said, women can be doctors too? And that's when it started.
So this part is really interesting. Earlier in your career in Flint, you were in Flint, Michigan, you started working with women who had experienced female genital mutilation, which is hard to believe that goes on, but it came over from, another continent. How did that shape what you do now?
My first practice was in Flint, Michigan, and that's right outside of Detroit, right outside of Southfield, where there's a lot of Middle Eastern populations, Indian populations, Asian populations, African populations, Sudanese, and their culture practiced female genital mutilation. And so coming to America, they did not want to continue with that, so they came to me for repair. And at that time, I was the only female gynecologist for a large distance, so that's when I started it. I also went to South Africa and spent 3 months there and learned about what tragic things that those women went through. So that's how I began.
Yeah, it's really hard to believe, and we won't get into all that, but it's
Absolutely.
Because it's a whole. We could probably spend hours just on that topic alone. But is there a way to, if someone's experienced that, so to repair the area so that they can return to a somewhat normal sexual function?
That's what I do.
Wow, that's amazing. That's really amazing. So, what was it like being one of the few female gynecologists in that community at that time?
It was just like any other physician. My partner and I did the same things. He didn't have the interest that I did, but it was just the way that every practice is.
So you're the only female gynecologist in Indianapolis. Why isn't there more competition there?
I'm not the only female gynecologist in Indiana.
I mean,
I'm the only
cosmetic
gynecologist.
Gynecologist, yes.
Yes. I'm the only cosmetic gynecologist here.
And so why don't you think there's more competition? Is it just not, is it really a niche kind of thing or within the area or?
Zane, I don't see it as a competition. I see it as
Right.
understanding what you want to do. And other people don't want to dedicate that amount of time to learning that female anatomy, to taking the studies and courses to learn it. So there's no competition. It is just something that I enjoy. I realized early in my career when they came to me that that's something I was good at.
Uh-huh. And the voiceover business, I'm switching back and forth just to keep you on your toes. It's called Michelle Savory. Where does that
Savory.
name come from? Savory. Where does that
Michelle
name come
Savory. That's my married name.
from? Oh, okay. All right.
And I didn't want to confuse my website for my voiceover with my website for gynecology.
Okay, that makes sense. So, for someone who's never heard of cosmetic gynecology, we just talked about the part about female mutilation, but other than that, can you describe some of the typical cases of people who are unhappy and they come in and you help them, come to grips or change, their outcome?
First off, I want to make sure that it's understood that I help patients realize that they're not alone. I answer questions that no one wants to even ask someone. But I've built that trust and reputation that they feel comfortable coming to me. So the essence of my job is to let them understand that there is nothing wrong with them and that we can find a solution together. But because they see that's something that I can do, they come to me with those concerns. I am a gynecologist, so I see gynecology patients also. Mm-hmm. But it's more of a trust relationship, which builds with communication, making sure that they understand that I hear them. I don't just see them. I hear them. And so I do that, and it just folds into those things that patients feel uncomfortable speaking with their physician. And their female genital anatomy, even with their husbands, they feel sensitive to. These ladies want to turn the lights out, and I give them comfort to say, we can fix what you're not happy with. But I also reassure them that they are normal. Mm-hmm. Everything about them is normal. But if they want to change, if they want to address some issues, I'll help them do that.
So I'm going to ask maybe things that will make listeners uncomfortable, but it goes to the what your patients or your potential patients really want to know. So what are some of the things that certain women will find uncomfortable about their gynecology, their vaginal
female genital anatomy?
Thank you. Female genital anatomy.
Yes.
What are some things that make women uncomfortable, about that?
Yes. Well, we'll start from the beginning, from the outside, the vulva, where there's the labia majora, the larger lips of the vagina, the labia minora, the clitoris, the space between the end of the bottom of the vagina and the anus. Women that have had multiple children get very stretched out vaginal canal. I address that. They are concerned that they don't feel their partner. They're concerned that air gets in there. They're concerned about maintaining a healthy sexual relationship. Progressing toward the labia minora, which are the inner lips of the vagina, those can be very large, very irritating with intercourse and walking, irritated when they are just wearing clothes, show through their clothes, unable to wear bikinis or swimming suits that looks like they have something in their pants. So I address that issue. And then painful intercourse. So I address those things. I also address women who, and this is controversial, that have want to restore their hymen. Some religions want a woman to be virginal, and so they come to me for revirgination.
Wow. That's really something. I've never heard of that. This is all new to me. So that's great. So that there's a lot of different things that are going on that you will address. And some of that being a man, I'm not even aware that these things are going on. But so I do have another plastic surgeon. I know he uses some sort of a device that he will insert in the vagina, and he says it's non-invasive, and it's one of the simplest things he does, and that tightens up the vaginal canal and increases. Are you aware of that particular?
There are many instruments that do that. I don't know
Yes.
which one he has, but because I'm a cosmetic gynecologist, that's in my repertoire also. But I want to let you know that it's not just men that don't know that. Women don't know it either. So my job is to educate them and let them understand their body and understand what's concerning them.
Okay. So, who's your typical patient?
My typical patient is a woman that either has had children and her vagina is very loose and she's not comfortable with her female anatomy. It's not tight. Air gets passed in there. There's a lot of noise with intercourse that she doesn't like. She has to cross her legs to feel her husband, or certain positions don't work, or she's just totally embarrassed and tired of having to do all types of things to feel the comfort that she did before children. That's the typical. Another typical lady is a woman that has very large labia that get harmed when she has intercourse because they get pushed in and torn, and that concerns them too.
Okay, so what do most women not know about their own body that surprises you? Or maybe nothing surprises you at this point?
At this point, nothing surprises me, but I am aware that they don't know their anatomy. When I first meet someone, I listen to them, and then I educate them on their anatomy. I have a pamphlet, a large page that I introduce each anatomical structure in the vulva so they can understand what I do.
Okay, so you talk on TikTok and Instagram about the taboo stuff.
Yes, as you've done your research. I have a TikTok and I'm on Instagram, and I'll answer any questions that TikTok and Instagram let me put up.
Because a lot of times they don't want to ask their regular physicians, or they're
Right.
embarrassed, or they feel
Right.
And so you have this reputation that there's nothing taboo as long as they don't say, okay, now we're cutting you off right there. I don't know, how does that work on TikTok?
Well, I haven't gotten one censor yet. I am very careful with the way that I choose my words. Again,
Yes.
communication is important. Being trusted is important. Understanding what you're saying, it's not just knowledge. It's the tone. It's the pace. That's what's important.
Okay, so what is the why do you think there's so much shame around this?
That's cultural. That's totally cultural. Women are in a place where that has always been taboo to speak of that. Now, people are realizing I don't have to live this way. I can make my choices.
Mm-hmm. So what do you think is the most misunderstood procedure that you do?
They're all misunderstood. They really, really are. Society doesn't let them accept that they just want to have a tighter vagina. They want their labias to look cute and perky instead of large, floppy labia that are dark and hanging, or one's bigger than the other, or they tear with intercourse, or they interfere with normal functions with urinating, getting toilet tissue caught inside when they wipe. It interferes with the dirt. It gets dirty and sweaty. People don't understand that. And women are so ashamed to say it.
Uh-huh. Oh, I can see how that would be true. So what do other doctors get wrong about cosmetic gynecology? So like, if someone goes to their doctor and they're brave enough to say something about their anatomy, and the doctor, I imagine, sometimes might dismiss it. I'm not sure, I since I'm not on that side of it. What do other doctors get wrong about cosmetic gynecology?
Just as uncomfortable as you feel speaking about it and you're trying to choose your words, trust me, they're uncomfortable too. They will tell them, that's just the normal variation. And it is. But they don't hear how they feel. They don't show the compassion that there's something else that can be done. They think if it's there, that's the way it needs to be, and there's nothing you can do about it.
Okay, so let's have some rapid fire, some fun. Just go with your gut. These are going to be all over the place. So, coffee or tea?
Both.
Okay. Exam room or
decaffeinated coffee if I drink it.
Decaffeinated coffee, but caffeinated tea?
Oh,
or
no.
decaffeinated both?
Everything.
Both decaffeinated. Okay, that's where my wife is. So exam room or recording studio?
Exam room. That's my
Okay.
love. Helping women.
All right. Okay, what's playing in your headphones when you're not recording?
I listen to a lot of classical music.
Okay. Who's your favorite?
I like Bach.
Okay. Favorite voiceover project you've done?
I do a lot of church projects. Welcome to Southside Christian Baptist Church, where you are welcome to blah, blah, blah.
So what's on your desk right now?
I'm in my voiceover booth right now. I have instructions on how to edit to make sure I equalize properly, compress. I have a bottle of water and a bottle of orange juice and my phone.
Okay.
Oh,
so
you mean project.
yeah. Well, either way, what projects are on your desk right now?
I have a project that's working with medical transcription.
Okay. So worst question a patient has ever asked you?
I can't answer that one, Zane.
Okay. Best compliment you ever received from a patient?
Just thank you. Just thank you. You've changed my life. Thank you very much.
That's nice. So your dog sits with you in the studio. What's his
Can
name?
you see him?
No, but I did my research.
Where'd you see him?
Yeah, I don't remember.
He's back right behind me right now. He's so quiet. Today I forgot to take his collar off. Sometimes when he scratches, he jingles. But I said, I'm not doing a project. I'm just doing a podcast. I'll leave him alone.
What's his name?
Maxwell. I named him Maxwell because when I was in grade school, I was mean to my teachers. If I could get away with it, I would do it. But my favorite teacher told me, "You're better than this. You can do more than what you're doing." He stood up to me and he set me on the path to being a doctor.
Oh, that's
The
terrific.
discipline on it. Because when I was in English class, there was a lady there that she got all the answers right. And I looked at her one day and I said, she's actually reading the assignment. So that's when I changed, when that man said, "You're better than what you're doing. You don't have to just get B's." And I was in grade school then. And his
Yeah,
name was
wow.
Mr. Maxwell.
Oh, okay, I get it. That's really great. That's a good story. So TikTok or Instagram?
TikTok. Instagram makes me sad.
Yeah, TikTok is kind of an upbeat kind of
Yes,
place, even with all the
yes.
crazy videos. And
Yes,
everything.
yes.
Scrubs or business casual?
Scrubs.
Are those scrubs you have on now?
No. I'm at home. This is my off day.
Okay, so that's a cute blouse anyway.
Oh,
So
thank you.
without naming names, tell me about a patient whose life changed because of the work you did.
I had a patient who had a tear into her urethra, straight up toward the bladder, and a tear right in her rectum. And she was having stool and urine leak into her vaginal canal. And I changed her life.
And what was her response to the whole thing after it was all done?
Just total gratitude. Yeah, how do you say that? Just total gratitude.
That's nice. So what does it mean to a woman to feel normal again after something like childbirth or menopause?
Well, I want to say what's normal, okay? It's normal to have hot flashes, night sweats, worry, diarrhea, constipation, anxiety, fogginess in your brain. That's normal symptoms of menopause. But what they have to understand is there are so many things that can treat that, so many things that can restore them to the way they feel comfortable.
How do you get a woman to kind of open up and talk to you? I mean, they come into you. They must have. Are most of the people who come into you referred?
No, they're self-referred. Most are self-referred. Some are referred, but But they're self-referred. They've read my website. They've read my blog. They've seen my before and after. They've perused my website. So they know about how I look when I'm gussied up. So they know that. So when they come in, I'm there for them. I open up to them. Eye contact, listen to them, compassion, clarity. It seems to fall together, and especially after I educate them.
Have you ever had a patient cry in your office? Not from pain, but from relief.
Oh, yeah, that happens. Just like in real life. If you're carrying a burden, to know that, oh my goodness, I can get some relief, that's astounding.
And what's the hardest conversation you have with patients? What's the most difficult conversations for you first, and then separately for the patients you see?
Well, I also do gynecology. The difficult conversations is when I find out someone has cancer. I don't tell them that over the phone. I ask them to come in. Those are the most difficult conversations. And we deal with it as it progresses. I deal with the answers. I deal with the questions. That's the most difficult. But I'm a gynecologist, and I deal with ladies with cancer. I deal with ladies that have female problems.
So what moment made you know you were doing the right work, or was there a moment somewhere along the line where you say, I'm on the right path. I'm on the path for me? Was there any one moment that kind of sticks out?
Yes, I used to practice with another gynecologist, and we had a joint practice, and I didn't like having to see patients in 10, 15-minute segments. But I had to, because we had to see patients. So I made the most difficult decision to go out on my own and practice medicine the way that I want to. Sure, I have time limits to see patients, but I make it so that they don't realize that they're at the timeline, because I hear them, I listen to them, and I can practice medicine the way that I want. So that's when I knew I was on the right track.
So what percentage of your patients end up as private pay versus insurance, and how do you handle that?
Most of my cosmetic procedures are all private pay. Cosmetic procedures are paid by them. And then my gynecology patients are insurance.
What about if you have some sort of, like if you're talking about someone who is having discomfort or, rubbing or things like that? Is any of that covered by insurance because there's other implications that are going on, or is it just considered cosmetic regardless?
If she comes in for her labia, it's cosmetic. If she comes in for her vaginal looseness, it's cosmetic. If she comes in for vaginal discharge, vaginal pain, because of other things that aren't relieved with surgery, that's gynecology.
Okay.
And we decide when they call to make an appointment. And they know.
So you've helped women who survived genital mutilation. What is that like to give them back that thing that was just taken from them?
You can only imagine. They're so relieved to not soil themselves, to not have to bundle themselves off. They're up. They're relieved.
So how do you make a woman feel comfortable talking about things they've never told anyone?
Like I said, Zane, they've seen my website. They've seen my TikToks. They've seen my Instagram. They've seen my YouTube. They see that I can talk. I will talk. So that was the best part of my business, is putting those questions and asking those things that no one else will see. So they come in knowing that I will say what you need to. I will answer what you need to say. And if not,
go ahead.
And if they haven't, they'll find out real soon once we talk.
So how do you find the time to do the TikTok and Instagram and the social media?
Or my voiceover too? I mean, come on. I mean, you, you make the time. Yeah, get up early in the morning. When you come home from work, you set that aside. Saturdays, I do 2 or 3 on Saturday and time them out to go out. You work it out. You work it out.
So this is, I don't know why I wrote this down. Actually, it says, why do you spend so much time on social media educating people for free? You don't have to answer that. I know why that goes on.
Because that's what I want to do. Woo! If you won't believe the replies I get, and questions that I get when I paste that, responses. It's like, oh my gosh, so glad I answered it.
How does the voiceover work feed the doctor work and vice versa?
How does it feed it?
Yeah, does it?
No.
They're totally different, but
Yes.
they just satisfy your interests.
Voiceover, as I said, it was a natural branch off from what I do, because I talk. That's all I do. I talk. I talk. So, and you don't have to have a good voice to be a good voiceover artist. You just have to be able to get your message across, be clear, be compassionate, and be authentic.
Oh, you have a nice voice, though.
That won't get you anything. But thank you.
So, if a woman is listening to this, and this is usually the last thing, but I have a couple more things after this. If a woman's listening to this and she's been suffering in silence, what should she do first?
Search out a board-certified cosmetic gynecologist that is experienced and has done several of the procedures that we have discussed. It's important to go to someone that is an experienced gynecologic cosmetic surgeon. You must have experience. This is nothing that a general gynecologist does. They don't understand the anatomy. So that's the first thing she should do.
So, do you do many consultations virtually?
Oh, yes.
And so how do you set that up? So if somebody wants to have a virtual consultation, do you have the ability to take their credit card and schedule everything just like it was an appointment, or?
Well, consultations are free. So
Okay.
that's out of the way. And I do a consultation with them the same way I would do if they came into the office. And then I give them information and I answer all their questions. If that's something that they want to do, we talk about how I can evaluate their anatomy by sending their photos to my HIPAA-Secure loading. That's through my electronic medical record, so it is HIPAA-Secure. And we go from there.
Okay. Do you have anybody who flies in to?
Oh, yes. Oh, yes.
Okay. So, so if someone wants to find out about you, you got to give me all your particulars, your website, and
Okay.
Go ahead and
My website is Indianapolis-cosmetic-surgery.com. My Instagram is cosmetic surgery of Indianapolis, and my TikTok is Michelle Jones Singer, MD.
Okay, great. And so if somebody wants to call you, how do they reach you on the phone?
My phone number is 317-578-0421.
We got to give you a plug because, for people who are watching this and they have these issues, they don't know where to go. They don't know where to turn.
Absolutely.
And this is kind of an unusual topic, but I really enjoyed, getting this information out there because it's not the kind of information that usually does get out there.
Right. It doesn't. And if you've looked at my TikToks, you know it doesn't. You probably turned it off.
Well, I wasn't too shy about asking the questions.
No, you were not. Thank you so much for the conversation. I really appreciate the space to talk about it and about trust, communication, and caring for people in a very human way.
Yes. So I'm going to press the. We're going to wind this up now. I want to thank you very much for for coming on with me. That was a great session. I think that the audience will really enjoy that, and we'll probably reach a lot of different people that we don't normally reach because the conversation is of interest to a large segment of the population. So hang on with me though for a second. I'm going to press the stop, and it's going to continue to upload. So